This is a case study project um, regarding one of the patients that I've encountered while at work at the hospital. I was reading charts, and we will just name this patient as John Doe, a 45-year-old female. John Doe came in the ER with chest pain, headache, and dizziness. John Doe past medical history includes ETOH, alcohol abuse or drug abuse, smoking. Of course, he's 45 years old and he has cardiovascular disease, hypertension, obesity, and sleep apnea. John Doe was immediately admitted to the hospital due to an abnormal EKG, and a few days passed, and John Doe was immediately transferred to ICU because of increased shortness of breath, even with lying down, fatigue, edema, and increased heart rate. This is a picture. So why would he be transferred to the ICU due to the abnormal EKG? Because after X-ray and tests, the radiograph shows a right-sided heart failure. Heart failure develops after myocardial cell damage and impairs ventricular contractility, which can cause disease contractility and reduces cardiac output and tissue perfusion. That's why, as you can see over here, he's intubated and has a lot of medication to sedate him so that the heart can rest. Right-sided heart failure causes inadequate pumping of blood to the lungs, and blood backs up from the left ventricle into the left atrium, then the lungs, which makes it harder for the right ventricle to pump, returning blood through the lungs, and this causes the right ventricle to eventually fail. He also has developed some pulmonary hypertension, this disease that results from narrowed or damaged capillaries in the lungs, which makes it harder for blood flow to the lungs and raises the pressure in lung arteries. What else? This patient also has an acute respiratory failure. So an acute respiratory failure is when gas exchange, oxygenation, and removal of CO2 fails. This is caused by a wide range of conditions such as drug overdose, infection, cardiac disease, exacerbation of chronic respiratory problems. So like your acute respiratory failure can be indicated by what? By testing abnormal ABG. It's below SpO2 below 91%, and they're hypoxemic and hypercapnic. Also, because of all those drugs and medication, patient becomes sepsis. Sepsis is something systemic inflammatory response to an infection manifested by fever, tachycardia, tachypnea. If not caught early, sepsis can lead to tissue damage or organ failure as manifested by shunting of blood to major organs and decreased delivery of O2. And it can impair the removal of CO2 and waste and vasodilation. And what else for this patient? That pretty much lists all his what's going on with him right now. Is mostly cardiovascular, but of course our heart is very important. It pumps blood all throughout our body, and that's why it affects every system that it encounters. Patient has comorbidities, of course obesity is one of them, and also substance abuse to drugs. That's why there's a rejection of all the medication, and that's why they have to sedate them. Wanna Neurological wise, when there's not enough blood going to the body, not enough O2 reaching the brain. So again, why is patient sedated, and why is patient letting the machine do the oxygenation for the body, is to rest all of that so we don't cause any more damage to any more systems in the body. That's pretty much it that I can discuss with the patient.